My name is Doug Lehman, and 10 years ago I became insulin dependent after a kidney transplant. Prior to this, I did not take any prescription drugs. Now I need 7 shots a day, and I'm on 32 pills. The price for these medications has steadily increased over the past 5 years. Recently, the cost increased $500 a month. At 66 years old, I've had to seek other employment to cover the cost. If I was not able to work, I could not get the anti-rejection drugs I need to continue this kidney operation. So, as president, what would you do to reduce the cost of prescription and life-saving prescriptions?
Thank you for the question. It's a pleasure to be here with you all. It's a privilege and honor to address you. Your situation is not yours, and by that what I mean is there are so many other Americans who are in the same boat, where if you talk to seniors in particular, they're being gouged. Notice drug prices never seem to go down, they only seem to go up, only seem to have one direction. And this is a uniquely American problem, unfortunately, because our society has been overrun by corporate special interests, including the drug companies. It makes it so that Medicare can't even negotiate drug prices on behalf of the American people. The drug lobby managed to push that to the side. So I have a 4-point plan to get the drug prices down, but then bigger picture, we have to make it so that when you need the money to survive, that you're not heading back to the workforce, trying to find a job in a workforce that might not welcome you or have a path forward. We need to rewrite the rules of the economy so it actually works for us, the citizens and owners of this country. It doesn't feel like we're the owners anymore. It feels like we're somehow passengers on a ship that we have less control over, but we're still the owners of this democracy. So the way you get the drug prices down, first, you give the government authority to negotiate lower prices. That seems straightforward, seems obvious, whatever reason we don't do it. The second thing is you say to drug companies, look, you cannot stick it to Americans at a level different than you're charging other countries. Does it make any sense to you all that they can charge Americans 2, 3, 4 times what they're charging people in other markets? It's because people in other parts of the world have governments that are saying there is no way you're going to charge that for this drug. What they do is they use international reference points and say this is the international standard, so you have to be plus or minus 10, 20% of that international standard. Does that make sense to you all? Yeah, America doesn't do it. America, the drug price gets set by the company and then we're all stuck with it. So what you do is you say to the drug companies, you have to come within this margin of the international standard, what you are charging other citizens of other countries. Number 3, if they don't go along with that, because you know companies just want to maximize the bottom line, they don't care about our health, they don't care about our well-being, so then you have to hit them where it hurts. You have to say, look, if you do not come within these international guidelines, then we, the government of this country, have the ability to license your drug, and then we have public manufacturing facilities where we can manufacture your drug. That is the giant club. And so if you're a company, you know if you push it too far, if you gouge the American people too much, the government will say, look, you failed the test, we tried to let you keep your costs under control, but you can't do it, so then we're going to take this license and then we have a public facility to manufacture that drug. Do you think that this plan would get drug prices down? Yes. This is how we get drug prices down. These companies only know one language, and it's dollars and cents, so we got to hit them where it hurts. They've long ago lost their sense of public interest, public good, public health. No. We have a system now where it just rewards the bottom line. Now, the second part of this is that our economy is becoming increasingly punishing and inhuman for people at every demographic. And when I was looking at AARP, they tell me it's not an acronym anymore, but I was going to say that the R is actually in question because half of Americans are never going to be able to retire. Just like you, where they're saying I have to work, work, work just in order to survive. And I have no interest in living in a country where I go into a convenience store, a grocery store, and there is an elderly American working just to survive instead of a teenager who used to do that job for beer money. Like that's the way it, that's the way it ought to be, frankly. I mean, instead of having an American who's never going to retire, is just going to work, and the numbers are staggering. You all know, half of Americans aren't going to have adequate retirement savings. We're entering an age where being old and poor is going to be the norm in this country. And so we have to change that, and my flagship proposal is the biggest expansion of Social Security that has been proposed in generations. It is the freedom dividend, $1,000 a month for every American citizen, starting at age 18 until the day you die. And so then if you need another $12,000 a year, it's coming to you because you're a citizen of this country. You're an owner and shareholder of this country. Now, how many of you own stocks of public companies that issue dividends? Many of you do. Verizon, Microsoft, Coca-Cola. So when these companies reach a certain level of success and maturation, what do? They return money to shareholders. I'm going to suggest to you all that the United States of America is at the exact same point, and that we need to start issuing a dividend to ourselves, the owners and shareholders of this country. And when Coca-Cola and Verizon and Microsoft issue a dividend, everyone says, great job, great management. It's time for us to do the same thing for the American people. $12,000 a year would be a game changer for tens of millions of seniors around the country, and would make it so that some people actually can live up to the R in AARP.